Hello friends, this is Dr. Heret Udawat. Welcome to my channel. Today I am going to share with you one interesting case which I had encountered just few days back. So the case is a newborn, a 2-day-old newborn, presented to our hospital with a chief complaint of unprovoked convulsion. Mother typically saying that the child is absolutely fine, he is taking feeding very well, but just before 1 hour we observe some tightening movement of the child. When I examined the child at first, I found there can be possibility of jitteriness because the vitals are stable, saturation is absolutely normal. Even we have done the blood investigation after admitting the child for monitoring of the convulsion, whether the second episode occur or not. And all the blood investigations are within the normal range. There is no evidence occur of the hypoglycemia, neither hypocalcemia. And there is also not significant history of any high-grade fever or any type of acute weight loss. After the admission, after 2 hours, I found another episode of the convulsion in front of me. There was tightening occur of the initially at the right upper limb with uprolling of the eyeball. It is progressing towards the tightening occur of all the forelimb. This episode has been lasted for only 30 to 40 seconds. We have started the anti-epileptic drug therapy. We have dig deeper. We have done other all blood investigation. Surprisingly, all the blood investigations are within the normal range, and child developed almost 3 to 4 episodes of convulsion in first 24 hours of the life. So we have planned for the MRI to rule out the cause of the unprovoked convulsion, and we found a large infarct into the left cerebral hemisphere. So now we are sure that we are dealing with the case of a stroke. So basically, there are 3 types of the stroke, as we all know. One is ischemic stroke, second hemorrhagic stroke, and third is a sinovenous thrombosis. So most common cause, according to the presentation of the child, that could be the ischemic stroke. So we have ruled out one by one etiology. First, we have taken the detailed antenatal history. The mother hasn't any complaint occur of the hypertension, neither any disease of inherited thrombophilia, neither any autoimmune condition to the mother. The labor progress was absolutely normal, no significant history of premature rupture of membrane, neither. Even the child is delivered very well cried immediately after the delivery. No any significant history of birth asphyxia. So we can't find any significant etiology related to the ischemic stroke for the maternal history part or examination part. Then we have ruled out the other etiologies in a form of like any cardiac conditions which can lead to dislodgement of the emboli. So echo was normal, no any significant congenital heart disease we found. We have also ruled out the other inborn error of metabolism which may have chance to causing this kind of the ischemic stroke. So the homocysteine level, all the other blood investigation has been done, which is also within the normal range. So now we are thinking the etiology behind that. One of the rare cause that we found that if the emboli has been dislodgement from the placenta during the last trimester or any other finding, then they have the potential to reach at the middle cerebral artery and causing this kind of the ischemic stroke like presentation. Because presentation of the stroke is very early, even after 24 hours of life. At 30th hour of life, the child is presented to our clinic, that's why. We have started the therapy. The low molecular weight heparin has been started. Child has been put on 3 anti-epileptic drugs initially. But once the improvement has been started, it was tapered down to the 1 AED. And when we do repeat MR angiography after the completion of the low heparin, then the infarct has been dissolved. In first angiography, we found it was in the main branch of the middle cerebral artery. That's why it is involving the major part of the left hemisphere. So the child has been discharged just 2 days back. It was taking fit very well, and we are hoping a good possible outcome in terms of development in future. The first time examination done by me at our hospital. For further investigation of MRI and related workup, all was done by Dr. Bhaven sir at Shaishav Children's Hospital. An angiographic related workup as well as for the low molecular weight heparin therapy was done by Dr. Vijay sir at Apple Hospital, Anand. So the key points which I want to convey to you after this case is that stroke is the more common than the brain tumor in a top 10 cause of a death in the children. And 25% of the stroke occur less than 4 weeks of age. And 50% of the stroke occur in less than 1 year of age. And 20 to 40% of the child who is having the first episode of the stroke, they have a chances to getting another episode of the stroke. 50 to 60% of the stroke survivor will have chances that they may have a delay occur into the development. Also, they have a chances to getting the recurrent episode of the seizures, as well as some alteration occur into the behavior as well as the social milestone, and also they are suffering from some learning disabilities. So if you find your child is having this kind of the unprovoked convulsion, do consult your pediatrician immediately. Don't ignore it. Thank you.